Is dementia ever misdiagnosed, or is it often masked by some comorbidity, which makes it really difficult to find until it maybe becomes mild or moderate?
Yes. The first problem that comes up is that many individuals themselves, but also their doctors, have difficulty distinguishing memory loss that's just due to normal aging versus memory loss that's actually due to Alzheimer's disease or another dementia. And I found that this is such a common problem, and is more common, as you would expect, in the public than among doctors, that the first book I wrote for the public, which is 7 Steps to Managing Your Aging Memory, What's Normal, What's Not, and What's to Do About It, was written to try to help the average individual understand these differences. And I'm pleased to say that my book is in almost every local library around. So if you're interested, you can check the book out of your local library. The other thing that often confuses doctors is that sometimes people have Alzheimer's, but they also have a few little mini strokes that show up on the brain scan. And if someone is not used to reading MRI scans or reading MRI scan reports, they may get confused and think that the few mini strokes that are mentioned on the brain scan report are actually the cause of the dementia, when in fact the cause of the dementia is Alzheimer's disease. Now, in the past, this has not necessarily been a huge deal because the treatment for both Alzheimer's disease and vascular dementia would be to use a symptomatic medicine, a medicine to help with the symptoms of memory loss, something like donepezil or Aricept. But today, it's actually a big deal because now there are actually medications that can remove those amyloid plaques from the brain that I mentioned before and can actually slow down the dementia. The FDA has actually given full approval for the first time to one of these medications, and that medication is currently available for patients from the VA. It's a complicated medication to administer. I'm pleased to say we are going to be offering it at VA Boston. And if you're at another VA close to VA Boston, many of these other VAs would just simply send you over to us to administer this type of medication. And the reason I'm mentioning this is that it's now really important to sort out whether or not the dementia is due to Alzheimer's or due to something else, because now we're using different treatments depending upon whether the person has Alzheimer's or, for example, vascular dementia.
Hey folks, connecting with your benefits is our primary mission, and the SITREP is providing more options than ever.
Subscribe to our free email newsletter, subscribe to our audio podcast channel, or subscribe to our content on YouTube.
For details and links, check out the description below.